Have already voted to do full distance learning to start the school year. Do you believe you have the legal authority to override that, or would you use that authority?
Can you say that again? I'm sorry, I moved the mic.
So a number of districts have already voted to do full distance learning to start the school year. Does the state have the legal authority to override that, and would you use that authority if you do have it?
Well, I think we're looking at a lot of things, right? I think you've heard the Department of Health gave the green light based on numbers. If I'm a parent in that district, which, I said that I would bring some of these emails so that you can hear what the parents are saying. I think that as a parent, I have to question what's going on, right? What are we basing those decisions on? Do we have the legal right? We're looking at every single case. And many of the parents are getting together. I just think we need to find a way to work together so we can get to that place that we all feel safe in the school building.
Will Cumberland have to reopen fully on October 13th?
What's the question?
The districts that voted to do full distance learning to start the school year, you're now saying that they're authorized to do full in-person learning.
Correct.
Do you have the authority to override their decision, and would you use that authority?
Gotcha, okay. I apologize, it was hard for us to hear. So a few things. It's a tricky question, right? We're actually trying to figure, we've never had this situation before. It's not clear that the state has authority, as you say, to force a district to do that. And I don't even know if I would do that even if we had that authority. Certainly parents, today's a big day. Today we've announced, after all of this work, everyone has the green light. RIDE's clear expectation is that they go in person, it's better for children, and the Department of Health says it's safe to do so. So in light of that, I am hopeful that some of these school committees who've made these decisions will now do the right thing and reverse those decisions now that we have this new information. If they don't, certainly they'll be exposing themselves to any number of lawsuits on behalf of parents who may demand in-person learning. It's not clear whether they might lose any of their federal funding now that we've officially said it's safe to go back to school. So the short answer is we're trying to figure out for the first time exactly our authority. Certainly a parent who feels they aren't getting a good education, as the commissioner said, can go to the education board and press the case that they're not getting a high quality basic education. So my hope is the whole time through this, I have, with enforcement and everything, we haven't been heavy-handed, we've been more enabling. They made those decisions. They made those decisions before today when we have the data. I hope they change their mind and do the right thing for the kids. If they don't, then I know parents are going to look into their legal remedies, and we will too.
Is there any update on two matters? One, something that the commissioner mentioned last week, where a parent may be able to say, let's say they go to South Kingstown now, SK says we're not going to go back to school full time. The parent may petition to send their kid to North Kingstown or Chariho. Is that something that is still on the table? And those are just benign examples. And then secondly, another follow-up. Let's say a kid is from Providence, lives in Providence, but they go to the Green School. Is that student, because they live in Providence, now going to be forced into distance learning, or will they be able to go through testing because the school itself is located in a municipality that qualifies for all 5 metrics?
Is that I'm sorry, is that a public school?
That's a charter.
Then yes, that student could go. Do you want to answer the first question?
So we're looking into whether a parent, if there's room in a district, can go to another district. We're looking into that. We don't know if that, we're figuring this out right now. But parents have most certainly asked about that to be done. So we're looking at that, and the governor answered the question. Remember, the charters and the private schools that pull from different areas have 4 metrics instead of 5.
What are the technical backgrounds of these inspectors? Will the individual schools opening inspection reports as well as the ongoing inspection reports be made public? And of course, what's the timetable for the release of the FEMA funds?
Okay, I'll answer some of that, and then I'd like the doctor to answer some of it. We are, just this morning, I was talking to Scott Jensen, who runs Department of Labor and Training. He's pushing his team hard so that we'll be able to release, you're talking about the unemployment insurance? Yeah. We would love for that to happen next week. Our goal would be to have, we have to not that you need the details. There's a lot of software recoding that has to happen. We're trying to get it done by Sunday, such that the money would start flowing to people's accounts next week. That's an ambitious goal. So if it's not done by this Sunday, then next Sunday, so it'll be the following week. Short version, next week or the week after.
In other words,
Sorry.
the inspectors that are going out to these schools, what qualifications do they have?
Okay.
Thank you for that question. It allows me to clarify our approach to this. We are not referring to these as inspections. We're specifically calling them walkthroughs. This is going to be an interdisciplinary team from the state who has undergone a training together, reviewing the checklist, which is pulled directly from the facility's guidance that has already been shared publicly, to go through with the school, how are you doing in meeting each of these measures? Where there are challenges, let's work together on how to overcome them. And as the governor shared earlier, if we can't overcome them, then we have to make adjustments to work together to keep people safe, do distance learning for a short period of time, give the school the time to overcome what the challenges are. And we can actually do that classroom by classroom if we need to support a school. In terms of additional expertise, we have brought on a variety of technical experts to support us. I already shared Arden Engineering, who's going to bring their engineering expertise and assist us with the various air circulation challenges that we'll want to overcome. We also have Jeremy McDonald, who's an engineer with expertise in air quality, who has expressed the willingness to join with us and offer support. And many have already met our research colleague, Dr. Erin Bromwich, who focuses on viruses that travel between humans and animals and has been invaluable in providing creative ways to overcome some of the normal challenges that are in place for us here in Rhode Island and in other places throughout the country. So that team, plus the team of experts that are from across our interdisciplinary team, is what we are pulling together to do these walkthroughs and work collaboratively with the schools.
Now, they are going to generate then a formal report by school, by classroom?
A report that they will be engaging with the schools on. We are sharing the checklist so that everyone's familiar with what we are pulling from the actual guidance to review, but we haven't made any decisions about publicizing exact answers because it's going to be an iterative process that we'll want to walk through with the LEAs.
As I'm sure you're aware, many cities now give grade restaurants, grade buildings, particularly sick buildings, New York City, A through F. Is there a movement to do that? Because ultimately parents are screaming for that type of data-driven approach right now, and that's typically been your approach.
Yeah, that's understood, but this is also different from the typical inspections approach that you are referring to. People, parents, communities, we encourage them to be a part of this with the schools. So there isn't going to be any information that's unknown. If there's a challenge, the people from the community will know that there's an element that's needing to be worked on with the schools. So we're going to continue to have this be a collaborative, iterative process that we'll work on with the schools, and a huge appreciation to our interdisciplinary team and the experts who are all committed and engaging with us and supporting schools and parents and administrators in every way.
One last follow-up quickly. Parents ultimately are going to be called upon to make the decision between homeschooling, the hybrid approach, or repurposing their children to other school districts. How would you ask them then to make a decision? Obviously there's an educational component, but at the same time there's also this safety component. How do parents make that decision if there's no outwardly driven data reporting?
What we are sharing today is a part of the data that we want to have out there. We're working collaboratively to engage parents going forward. We had a call with superintendents over the weekend. We're going to continue to do that. Our focus is making sure that parents, school administrators, teachers, and students can have the confidence in this process. We're the only state that has pulled together an education operations center. That's unheard of. And it's genius, in essence, to be able to make that type of responsiveness available to schools and to families. We have the rapid testing system that's in place. We've had hundreds and hundreds of hours working together, planning, putting together structures, thinking through what we need to adjust, and we have the child care experience to lean on and show how we can produce together. So we want parents and schools and teachers and students to see the amount of work that's going into building that confidence for them, and we'll continue. We'll work with them, and similar to the beginning of childcare, there was a lot of reticence. People weren't sure what was happening. Even the providers, we were told, were saying, I'm not sure what to advise you. Over time, parents saw, the child care leadership has done a phenomenal job, and the providers see that we can stop secondary transmission, we can keep people safe, and you can go to child care and go to, send your children to child care and be able to go to work, and we want to be able to do the same with schools.
Universities nationwide are reopening, only to find themselves forced, in many cases, to reclose. Is there a finite, or is there a defined trigger point at which point the Department of Health or the Department of Education would recommend to the governor that, in fact, we step back and reclose these schools?
Specific to institutes of higher ed, there is a very comprehensive, multifactorial approach to how we want to not have done in our institutes of higher ed in Rhode Island what we've seen happen across the state, across the country. The first is our engagement directly with institutes of higher ed leadership. All of them have expressed a commitment to holding themselves and students accountable to following the rules that we know work to prevent COVID-19 transmission from occurring. If we have students in this age group that are coming together, not wearing masks, disregarding the distancing that's occurring, not washing their hands, not following the rules, schools have already the tools in place to hold them accountable. We don't want students suspended, but if they're not listening and putting other people at risk, that can happen. And when schools and leadership do that, and the state, as we stand ready to support them in enforcing that, we can get through this in a way that allows students to have a productive, successful academic year safely. So we have the opportunity in front of us, and working in partnership with the institutes of higher ed, that's what we'll plan to do. If we see a significant number of cases that are a result of violating those rules, we will take a step back, work with the institutes of higher ed, and make decisions about what else we need to do.
Specifically to a trigger point for closing schools under the control, if you will, of RIDE K-12.
So K through 12, there is a very extensive process for doing that. It involves what is happening with the cases in schools, how the school is doing in responding to those cases, and what's happening in the community that the school is within. Over time, we'll continue to share more details as we are bringing that to school leadership as well.
Governor, about the new testing system, will teachers have the ability, with this new testing system for teachers and students, will teachers have the ability to get tested before school? And what about substitute teachers?
Asymptomatic teacher testing before school?
Yes.
Yeah. You want to take that?
And this is K through 12 schools?
Just in general, I know the governor announced a new testing system for teachers.
K-12.
I'm already getting email from teachers asking, will they have the option to be tested before school? And what about substitute teachers?
Okay, two answers to that. Our focus, our primary focus with the rapid testing system that is being set up immediately now is on symptomatics. People who have symptoms are the most critical to quickly be able to identify, minimize disruptions to the classroom, get them isolated and supported, and get any of the close contacts quarantined. So as we start September 14th, our focus is on the individuals, staff, students, teachers, substitute teachers, all who are engaged in the K through 12 system. If there are symptoms, we want them to be able to access this system and get tested. That's our primary focus. True to our comprehensive testing strategy, after symptomatics, which is the S of SOS, outbreak response, which is a key component that we also will be staying in front of, we also have the Sentinel surveillance testing option, which is the early warning system. The second piece I want to say that adds to that is teachers do not need to get tested in order to return to school. That was also the message we said as we were reopening the economy. Testing for people without symptoms is one moment in time. You could get tested today, go back into the community, not wear a mask, have people around you not wear a mask, get exposed by the evening and be at risk. So testing that is available for teachers who are not symptomatic is not a requirement in order to come back to school. Everything we shared today about readiness is what's going to work the best to make it a comfortable, confident, safe place for people to return to school. In terms of testing for someone who does not have symptoms, you can continue to follow the variety of options that exist. One is going through a primary care provider, going to one of our respiratory clinics, and if someone qualifies as being a high-risk contact individual, they can pursue our portal for asymptomatic testing, portal.ri.gov. Particularly the teachers who will be working very closely with students, and particularly younger students in classrooms, whether they are a teacher who's routinely there or a substitute teacher, they can qualify as the high contact worker for K through 12 and can go to portal.ri.gov to participate in asymptomatic testing, but it is not a requirement in order to feel safe to return to school.
I should have said this earlier, and I apologize. Tomorrow's 1 o'clock press conference is going to be dedicated to testing. So each day this week, we're going to have a short 15 minutes, schools, different topic, and tomorrow we're going to do a deeper dive on testing. So she just gave you all the details, but for anyone asking you questions and you're curious about testing, tomorrow, all testing.
Governor, I just want to follow up on that. Now, you know, you announced the Take It Outside initiative, and then at the same time, today was supposed to be the first day of school, and now you gave them 2 more weeks to get ready. Now there's another 4-week delay for some of these districts that maybe signed that letter last week. Aren't they losing valuable time the month of September when they should be outside? Or they could be outside, I'm saying, if they opt to do that.
Okay, let me say this. I'd say yes and no. We wouldn't have been ready by today. So, yes, you're correct. You are correct. Every day these kids are out of school is not a good day for them.
Some schools went back today, correct? I mean, Bishop Hendricken did, LaSalle. I don't know if your children are back in school.
Okay, sorry, not yes, absolutely. Private schools, parochial schools, yes, but no public schools have gone back. So every day these kids are out is not a good day. We weren't ready for today. So we just weren't ready. You know, we're trying to get it right. We're trying to keep everyone safe. The testing wasn't ready before today. We didn't have enough PPE, so we had to push it back for 2 weeks. Having said that, I hope they do teaching outside for September, October, maybe even November. Have lunch outside. Have as much you could do outside, as much you could do with the windows open. It's good for the kids.
With these building inspections just happening now, is that giving teachers and districts enough time to plan for if several classrooms cannot be used?
Yes, I think so. Every district has a plan for full in-person, full distanced, and hybrid in between. So yes, and they're all going to have, the walkthroughs are going through starting like right now, and they'll be, as the doctor said, hands-on. So if they go through and they say you need, I don't know what you need better air quality or better air, not so much quality, but circulation, we'll help them fix it. So they ought to be able to be online by the 14th or shortly thereafter.
And with the air ventilation and circulation, are they also looking into what this means come winter with HVAC systems, especially the schools
Yes.
with the older HVAC systems?
Yes, that is a big issue. A lot of the schools, particularly in cities, Providence, Pawtucket, et cetera, they're very old buildings. I have a big initiative to rebuild schools, but that hasn't happened yet. So a lot of these buildings are old, so it'll be harder in the winter. But, you know, as John says, we got to get them now into school when you can open the windows, when you can go outside, start getting them in school, and also preparing for December, January, February, when we know they have to be inside.
On Providence and Central Falls, do they need to get below that 100 case per 100,000 threshold in order to reopen in October?
So, excellent question. Probably. So why do I say that? Because as I said, what I was trying to say is we are going to start to focus a lot more on percent positive, because when you're testing 10,000 people a day, or in the case of Providence, if we get to a point where we've tested 30% of the population, you know, the more you test, the more cases you find. You test more, you find more. So if in Providence we've tested 30% of the population, the test positive rate is 1.5 or 2%, but yet they are at 100 per 100,000, the Department of Health may decide, in light of everything, it is safe for them to go ahead and go back. So we said a month ago, 100 cases per 100,000. There's a lot of logic to that, which we've gone through. But now that we are testing so many people, we have to, it stands to reason you're going to see necessarily more than 100 per 100,000, but if test positive, the percent of those tests is sufficiently low, we may say they can go back.
What about the reverse of that? Let's say a district goes well above 100 to 100,000, like Pawtucket, let's say, goes up to 125. Is that an automatic shutdown, or is there any metric right now?
Yeah, go ahead. It's a good question. It relates to your question, too.
Yes, both of these are connected. Once we are past this starting point, we will be taking a comprehensive approach to how we're engaging with the schools. In addition to what we're seeing at the municipality level, the cases, the percent positives, what else is happening in the community, we will be doing a lot more based on how the school is doing. How many cases have you had? How has your response to those cases been? What type of support have you needed? How much secondary transmission has occurred or has not occurred? That is what we're going to take into account in a month when we get back with Providence and Central Falls and make an assessment. And that's what we're going to be assessing on a regular basis with every school as we're going forward, and in partnership between RIDE, the Rhode Island Department of Health, and the school district, we will make decisions together about whether or not we need to move a particular way because of what we're seeing at the school level primarily and what's going on in the municipality and the community.
Mike, last question. All right, for the governor, you said something earlier that struck me, and you talked about the idea that the days of sending your kid to school with a couple of Tylenol were over, and we all understand that. But it made me realize a couple of things. One, I watched something like that play out over the weekend, you know, where a 9.5-year-old developed a sore throat, so she ends up going for testing, and she's probably fine. And, you know, she's happy and playing on the computer, and she's not ill in any other way. And yet her mother now can't go to work. She had to take the day out, and friends of theirs that they had associated with over the weekend. Someone maybe had a runny nose, had to get tested, and then another parent couldn't go to work. And the ripple effect is really profound. And it seems to me that this will pose repeated and recurring obstacles to the reopening of schools. Yeah. Because it's one thing to say, well, we're going to reopen, we're not going to reopen. And it's also one thing to say, well, we'll take a week off or 2 weeks off. But it's going to become a serious practical impossibility to say, oh, well, I'll take today off, and then next week I'll have to take Wednesday off. But I don't know that yet. And
yeah, no, you are correct, which is why we're so focused on testing. Because and I want the doctor to answer this, but if your kid wakes up in the morning, the 9.5-year-old with a runny nose and a fever, you cannot send them to school. We can then get them tested. Or similarly, if the kid is in school and comes down with those symptoms, we'd like that child to be tested in school. So that is what we're going to try to move towards, where we can identify the difference between someone who has a runny nose and someone who has a runny nose who's tested positive for coronavirus and has to be isolated.
So the two things I will add to that is the rapidity of the testing. Doing the testing quickly is the key component here, making sure it's accessible and that we can get a quick turnaround time in a day, 2 days at the most, and minimize disruption to the classroom. A huge kudos to our testing team and everyone that has worked very hard because of that specific issue. The second point that I'll share is there was also an extremely thoughtful approach to helping to differentiate which students just have some symptoms, but it is less probable that those symptoms are actually COVID-19 and require testing, and which students have a few symptoms that are most consistent with COVID-19, and we do need to hurry up and get the testing done. So there's a small proportion of students who would not qualify as being a probable COVID-19 case because of the types of symptoms that they have. They would still need to stay home, but would not have to go through the process of getting tested. As soon as they are 24 hours without symptoms, they would be able to return. So that's an element that we developed statewide very thoughtfully in partnership with our providers and understanding the testing system so that we can minimize how much disruption occurs to students, the in-class learning, and to families. That was our primary focus.
Great, thank you. And I have one follow-up for the governor. You said that in the course of the discussion about the Tano, we've all done that. And that made me realize that Rhode Island is probably, I haven't checked this of course, but it almost certainly is the only state where our pandemic response is being primarily run by 3 people who are all mothers of young children. And I'm curious if all of you would like to comment on what insight that's given you and what difference you think that's made in the state.
Yeah. In this regard, I feel comfortable answering for all of us because we've talked about this a lot. I think we are the only state where this entire effort has been run by moms. And I'd like to think it's part of the reason why it's going so well, because we're all stressed about our own children. We worry about their teachers. And I think it makes us a little more aware of what's going on the ground. So it's one thing to get up here and say, these are the policies. But it's another thing to be a mother, to say, how am I going to convince my son, to wear his mask every day? How am I actually going to convince him to not forget his mask? Is this going to be safe? So anyway, you think about the real world implications of what we're saying up here, and hopefully that makes you think of some things which we then take into account when we make the policies. Because it's not that we are detached. We're all going to be in schools with our kids, with our friends' kids. And so you just you have an ear to the ground. what's really going on, sometimes what we call the ground truth, and it might make you a little more aware of how you make better decisions. Plus, I think we can relate in a real way to people's anxieties.